Hey everybody, talking a little bit more about how to know it's not a wart or a Verruca Pedis. Now, looking at these differentials, it's really important to make sure that you're getting it right, because you can see for some of those later ones, you don't want to miss these. Okay, but really the most common thing that it could be otherwise is a corn or callus. Now, when you're looking at these areas, if there's no changes in the skin striations, it's less likely to be a wart. And so when you're then looking at some of your clinical assessments, what you want to do is start palpating. And if you're pushing, it's more likely a corn. But if you're squeezing that lesion and it's causing pain, then it's more likely to be a wart. Callus won't always be painful when you're pushing and poking or squeezing, and so that's another way that we can assess to make sure that it's not a wart or a verruca in this case. But if you're finding pain on palpation, there might be some on squeezing, don't disregard the fact that it could be a foreign object. In these cases, there might be evidence, or your clinical history may show that there's a foreign object there. If you're unsure, potentially debriding and seeing if there's any clicking, or otherwise undertaking an ultrasound and x-ray should be able to differentiate what's happening there. Now, with seborrhoeic keratosis, it's typically a nice benign lesion, a little bit darker, potentially a bit waxy, and so that can be a bit of a telltale that it's not a wart. You're not necessarily going to see those skin striation changes that we're looking at. Now, squamous cell carcinoma is going to be very irregular. There may be some abnormal bleeding. There may be the edges that are, or borders that are abnormal. And so really starting to take into account sort of looking at your different changes that can occur due to skin cancers. And of course, if you're unsure with any skin lesion, it's about making sure that you refer that through to someone appropriate sooner rather than later. But for the moment, this has been a few differentials for warts and Verruca Pedis and how to know the difference between those. If you liked what you've seen here, hit the subscribe button, check out some of our other videos, and we'll hopefully see you there. Cheers.